Well, hello and welcome to this exciting class. On today's topic, it's just step therapy that we're going to tell you all about what that is in just a moment. But at first, I want to thank everyone who's coming in to the webinar now and who are watching it on recording. We know that especially with AI arthritis diseases, flexibility is extremely important. And that's why we do these recordings. And we also encourage you after the recording to still submit questions and comments. We're always here to listen, and we'll teach you exactly how to do that as well. So we're going to see who is on this today, and then I'll tell you a little bit more about the program and the topic. So first, I would like to welcome Sarah Buchanan from the National Psoriasis Foundation. Hey, Sarah, welcome.
Hi, thanks for having me. I'm with the National Psoriasis Foundation, and I'm the Director of Federal Government Relations and Health Policy. So I've done a lot with step therapy policy on both the state and the federal levels. Thanks for having me.
Awesome. All right. Jody.
Hello, everybody. Thanks for joining us today. My name is Jody. I live in Massachusetts. I have psoriasis and psoriatic arthritis, diagnosed about 10 years ago after 15 years of misdiagnosis. So I guess it's closer to 35 years I've been suffering. This step therapy is very important to me because as my disease progressed, my treatments also had to get more advanced. And step therapy made it so that cost was more important than my health. And they prevented me from getting timely access to treatments that I needed. And as a result, I suffered irreversible joint damage. So this is why this topic is very important to me.
All right. Thank you so much, Jody. And I'm sorry, where are you tuning in from?
Massachusetts, Plymouth, Massachusetts.
Massachusetts. All right. Okay. Thanks for joining us. Jody is one of our class discussion leaders today, and person, as she said, living with psoriatic arthritis. All right. Hey, Brittany.
Hello. Hi, everyone. I'm Brittany Murray. I am in St. Louis, Missouri. I've had psoriasis for 30 years and psoriatic arthritis for almost 20. And this topic is very near and dear to my heart because I started, like many people, on methotrexate as a teenager, and all of the lab work and damage that comes with that. Just an awful experience. But I had to do it to get to like a Humira. And I'm very excited to say, though, that I just missed another opportunity for step therapy a couple weeks ago where I switched drugs and I was told insurance isn't going to approve it. But because we have step therapy laws, I was able to go straight to the medication I need. So I'm pretty excited about that.
That is super exciting. And we're going to hear a lot more about that from Sarah in a little bit when she tells us about the issues and how we can utilize our stories to help people like Brittany, like Jody, like myself, like many of you who are participating today, so that we do not have to subject ourselves to this practice of step therapy, which I'll define here momentarily. I am the CEO of the International Foundation Autoimmune Autoinflammatory Arthritis. That is a long name, so we just say AiArthritis for short. And I am diagnosed with another long name, non-radiographic axial spondyloarthritis. And I was actually a college teacher for a decade. So I am your instructor. I'm very excited to be back to the classroom. This is actually a very, very fun thing for me to do, and I'm very passionate. So this is part of our Knowledge is Empowerment, patient-led public policy, education, and action program. So everything that we're talking about today, as far as lessons learned and videos you'll see and ways you can get involved, were inspired by patients or led by patients. And if you join us, then it is peer-led guidance, education, and ways to get involved. We want to thank our project supporters for making this possible. And how do you participate today? So this is class participation. We don't like just boring old lectures here at our AiArthritis classroom. No, we like people to get involved. So you can watch and learn these presentations and these videos that we're sharing. We encourage you to discuss in the chat. If you haven't already, say hello. Tell us where you are. If you're a person affected by these diseases, how. So really use that chat feature. We'll even share the transcripts of the chat with those who register, because there's a lot that happens in the chat. We don't want you to miss out on that. And just because this class ends, it doesn't mean that that this webinar is the end all be all. There are more classes, more webinars coming up. There are field trips, which I'm going to tell you a little bit about later on, and elevated experiences, which means if you would like to learn more in depth how to share your stories, you'd learn more about how all of this works to influence your access to care, you can sign up for our official classroom program and get peer-to-peer mentorship and all other types of really elevated experiences that are unique to AiArthritis. There is a glossary of terms. Sometimes the terms are hard to follow. It is a live document, which means we're always updating it. Michael's going to share it. Oh, he already has, because he's good and fast. So Michael has shared that link in there. And if you hear anything today, you're like, I don't know what that means, share that in the chat. We will continue to record those terms and add them to the glossary. So your participation also important. All right, here is our outline. What is step therapy? We're going to then go into how does step therapy impact rheumatology patients, which is really, why should I care? We're going to tell you why you should care. Then we're going to go over to Sarah, again, from the National Psoriasis Foundation. She's going to tell us how to get more involved in some of the action items that are happening here in the US. But if you're tuning in from other places outside of the United States, this is still relevant for you, because AiArthritis is international and we do work in other countries as well. So we will make sure to help you translate what we're learning today to your country. Stories matter. We're really going to encourage you to share those, and then we're going to give you an action plan. All right. So up first, what is step therapy? If you have never heard of this before, chances are it has happened to you. So what step therapy is it's an insurance, or depending on where you live, sometimes it falls into more of a government method to save healthcare costs when they do this by asking you to please try and fail a medication before the one that your doctor had prescribed. The process is supposed to be to try to save time and money. But the problem is, we know because of our diseases, this could actually cause harm if we are delayed in our or we disrupt our continuity of care. I also wanted to add, because of my personal story, which I'll share with you a little bit later, it could include non-medical switching. That is when your insurance company or the person who's dictating which drug that you are required to take, because it is the lowest cost to them, where they are switching you for non-medical reasons. So it's really right in the name. And this is what had happened to me. And as a result, I was asked to take off my therapy, try a different therapy, fail that before I could go back to the one that I was on for 3 years. So that's a big issue. And I know that's an issue that we're going to talk about how to solve that in legislative public policy, sharing your stories issues. This process was created over a quarter of a century ago. It's old, and we're still working on changes. Okay, but I think the point to take away here is it's old, and it does need to be revised, because as we get more innovative biologics and other drugs into our community and our diseases, with having very unique presentations, all of this is really, really important. Because our biologics are not generic. They're not like an aspirin. They're not something that can be easily duplicated and just switched out. So this is really, really important, in particular to people with rheumatic diseases like ours. There's even an issue where, and I think Jody, you sort of alluded to that earlier, you could go to a different insurance plan or a different plan. You've already tried and failed the drug, and they still make you try it again. Literally, what? So that is an issue in itself that we really, really have to consider when we're talking about step therapy. So that is a good, I think, overview. Next, what we're going to do is we're going to actually hear from Jody. She's like, oh, wait, that's me. So I've got a little clip here, and this is a video from, or not from you specifically, Jody. It's your video here. I saw you turn your mic on. So we have a whole video library in this classroom. And with those library is this, we have these short videos, some that after we're through with this webinar, we hope that several of you will submit some of your step therapy stories once you see how easy it is. So I'm going to go ahead and let Jody, in her own words, tell you what step therapy is.
Step therapy, also known as Fail First, is a practice used by health plans to control insurers' cost. Step therapy actually prevents patients from accessing the treatment prescribed by the physician by forcing them to try one or more alternative treatments, and they have to either prove to be ineffective or harmful, actually harmful to a patient's health, before stepping up to the treatment originally prescribed by the physician. Insurance companies are making decisions that should be physician-based, and this is just not acceptable.
Well said, Jody. And that is the reason that we have many different versions and small clips, is because everyone can speak about what you hear and what is important to you in defining this topic, because there are many points we want to focus on, but it's important for us to be able to turn this information you're learning into your own words so that you too can explain to other people, your medical team, your family, your insurance company, your legislators, people who could actually change the processes. So getting to understand and speak in your own language is really important. And that's one of the things we really try to do here at AiArthritis through this program. So next, we're going to jump into lesson number 2, which is how does step therapy impact rheumatology patients, which we sort of alluded to in the first part here, or why should I care? We've got a little chat to do here. So in the chat, continuity of care, which means don't disrupt the treatment, right? So it's important that we have continuity of care. It's very vital. I have a question for you. If you were ever stable and doing well, and you were suddenly asked to switch to a different biologic, how would you feel? Or if it has happened to you, how did this feel? Go ahead if you feel comfortable and chat about that. It's a very important topic, and we often learn by communicating with our peers. So if you're comfortable, we certainly encourage you to share whether it happened to you and how you felt, or if this would happen to you, how would you feel about it? All right. Some things to note, and this is really important just to understand why step therapy in particular is important to rheumatology, autoimmune, autoinflammatory arthritis patients. The average onset of our diseases is 20 to 40 in adults and any age in children, even birth. Now, that doesn't mean there can't be onset later. There's actually a new thing called late onset RA that I just learned about when I was at some of these rheumatology conferences, where they're starting to see onset in ages 60, 70 plus. So this is just the average, the typical onset, usually early. And the reason we say that is because the recommended window to treat our diseases to improve chances of achieving remission is 6 months from onset. Just curious. And I'm going to ask Jody and Brittany here real quick too. Jody, you said, how long did it take you? 15 years?
Almost 15 years to get the proper diagnosis. So I was untreated all that time.
Okay. And Brittany, what about you?
For psoriasis, it was pretty quick. For psoriatic arthritis, it was that whole, you're a teenager, is it growing pains? Is it, fibromyalgia? Is it depression because you quit soccer? Like it was that whole thing of having to prove like, my joints hurt and they shouldn't hurt like this at 14, So I did get a diagnosis kind of quick, but having to reestablish that over the years has been kind of troublesome. Like I've had to prove it over and over and over again.
Yeah. For myself, I was a mystery patient for 2 years. About a year into it, diagnosed with undifferentiated connective tissue disease. And the important part of saying that is because the rheumatologist at the time, and this was 13 years ago, said, I'm going to wait and watch you get worse. I'm not going to treat you. And now I'm an educated person about these diseases, and I actually know that you can be treated with at least some level of disease modifying agents like a methotrexate, for example, which may be familiar to many of you when you're diagnosed with undifferentiated disease. So she chose not to treat me, and that actually closed my window of opportunity and put me on a long journey, which for me is another reason why step therapy and understanding how important it is not to implement on our diseases. I'm fighting that window. I want to achieve remission. And the more step therapy is applied to my treatment and I'm pushed off the medication that my doctor and I feel is the right for me, the lower the chance I have to achieve that. And the higher the chance that we have to develop comorbidities. There's a lot of people out there, I bet, on here right now who are not just diagnosed with their one disease. I have Behçet's disease also on my chart. It's an autoinflammatory arthritis. I don't talk about it that much because it's not my primary, but I do have that, and that started after my disease a few years in, developing severe cold sores in my mouth where it was almost impossible to even talk. But that was because of uncontrolled inflammation. Other comorbidities, just from being diagnosed, we have a significant increase for developing heart disease, and we're 4 times more likely to develop Alzheimer's and dementia. That is also due to inflammation. So we have to think about our long-term disease journey and be protective for ourselves. And these are all reasons why, specific to our diseases, specific to rheumatology, this is important. And I'm mentioning this because as we talk later into what can you do about it, these are good speaking points, because step therapy is a big topic and it covers many, many people. But these are things that are effective to say when talking to people about why it's important for our community. So as you can see, Michael has put in the chat. So if you're stable, as we talked about earlier, and if you've been chatting about that, go ahead and continue. I'm going to play another short video from Lisa, who I saw is in the chat, and on why you should care.
Problem is, while you're waiting while you're trying the drugs, the insurance company wants you to try and fail first, damage can occur. And other health problems can be caused because you're not taking the drug that your rheumatologist and you have decided would be the best. And that can cause more expensive health problems later on.
All right. And Lisa, shout out to you. And I wanted to just quickly point out before we move forward to our lesson number 3 and we bring Sarah back on here, is how raw our videos are. So one of the things that we decided as a patient-inspired, patient-designed program is we wanted to encourage as many people as felt comfortable to be on camera to be able to share their perspectives. So these are all videos made simply by holding a telephone in front. So I said telephone, now I really dated myself. My Rolodex and my video recorder out too. So whether it's on Zoom or just holding your cell, we have ways. And if you're not comfortable speaking, we also will get on camera with you and ask you questions so we can capture your responses very naturally. So those are just, anybody out there who's listening can be part of this, of these stories, and you can use these also for your own stories if you would like to join our efforts in fighting and combating these unfair practices. Boy, Lisa, they just want you to keep going. All right. I was going to keep her playing. All right. So next up, we do have Sarah coming back. Sarah, welcome back.
Yeah, thank you. And Tiffany, I can get behind a telephone, but I draw the line at fax machines. That's where I just can't figure out how to use them correctly. Yeah, so thanks so much for having me, and I'm happy to talk about some of the legislative efforts. Organizations like the National Psoriasis Foundation, as well as AiArthritis and many others, have really gotten behind legislation to help streamline insurance step therapy processes for patients. Jody and Brittany did a really good job explaining some of the implications that step therapy, negative implications that step therapy can have. So we're trying to do something about it. Next slide, please.
All righty.
Yeah, I can skip this. So this is just a definition slide. Tiffany already did a great job covering it. Step therapy is when a health plan makes you try and fail on one or more preferred treatments before the plan will agree to cover the one that you initially selected by with your provider. Step therapy is a form of prior authorization, and both step therapy and prior auth are a form of utilization management. So it's really the health plan trying to save their own costs. Tiffany said it perfectly when she said it's not necessarily that the plan is trying to make you step to a cheaper medication. It's just that medication, for whatever backroom deals they've made, happens to be cheaper for that health plan. And sometimes plans actually steer patients towards more expensive medications to get that patient to pay more for their cost sharing. So it can be a really frustrating process, not only for patients' out-of-pocket costs, but also, even more importantly, for that patient's overall health and health journey. So next slide. So one reason the Psoriasis Foundation is so involved in step therapy legislation on both the state and the federal level is because, as Jody and Brittany already alluded to, delays in care can and do lead to severe or irreversible health outcomes. So we've seen that before, where one patient that advocates with us was stable on her treatment. She was doing great. And then her husband got a new employer-based health plan, and she was required to go back and fail all the same medications that she had tried and failed before. And by the time she finally got access to the treatment that was working for her, her health had deteriorated so much she needed her thumb joints replaced. And we absolutely hate to see that happening. And one reason step therapy is such an egregious form of utilization management is because it can take patients 2 to 3 months to prove failure, basically to get sicker, before the health plan will check the box for that patient and move them on to the next treatment. And that 2 to 3 months can be really devastating for patients, especially with patients with autoimmune and immune-mediated diseases. So next slide, please. So we have been working on both the state and federal level to advance legislation that would streamline the step therapy process. Our federal bill is called the Safe Step Act. It's based on legislation that is passed in a lot of states. I'll show you a map. So basically, both the federal bill and the state bill would ensure that health plans offer an exceptions process, so that if a patient is being forced to try and fail on a treatment that's not going to work for them, they can seek an exception and get a response within 24 to 72 hours. So that time frame hopefully helps patients bypass wasting 2 to 3 months on a treatment that's not going to work and getting sicker in the meantime. Next slide, please. So the Safe Step Act, like I said, is based on laws that have passed in 37 states. Most of these laws have very similar approach, where they're just trying to help patients access a quick and medically reasonable exceptions process. It's been amazing to watch over the years the progress that patient advocates like Jody and many others have had in and Brittany as well, have had in passing laws in their states. And it's exciting as a federal lobbyist to see how the more states we can color in, not only are you providing protections for people with state regulated plans, and I'll cover that in a moment, but not only are you providing protections for people in those states, but you're also lighting a fire under the US Congress to do the same for employer plans. So it's like a double win. If you can pass a law in a state, you're also affecting federal policy as well. So kudos and congrats to this amazing effort so far. And I know that patient organizations are committed to trying to color in every state and make sure that every state has a step therapy exceptions law. Next slide, please. So I've alluded to this before, that these state laws apply to state regulated plans. This is going to get a little wonky, so bear with me. And if you don't get it this first time around, don't even worry about it. But just if you're curious, because I get this question a lot, the state laws apply to state regulated plans, but not every person in that state that passes a law has access to this exceptions process. And that's because the state laws tend to apply to the individual and small group markets, as well as fully insured plans. So I work for a foundation that has less than 200 employees, and we have a fully insured plan. So my fully insured plan would be subject to that state law. There are larger employer-based plans like Microsoft or Amazon that are self-insured, and those larger plans are under federal law. So that's about 30% or 40% of people in every state. That's why we're also trying to pass a federal bill so that, in a state like Texas, which passed a really strong step therapy exceptions law, we can make sure that, people with the larger employer-based plans also have access to this exceptions process, as well as the rest of the state with commercial market plans. I'll point out that Medicare does also have a very similar exceptions process. So hopefully with this federal bill, we can start to close the loop and make sure everyone have access to an exceptions process. Happy to discuss this further if it's of interest, but just, and it's a little wonky, so you don't need to be an expert on this, but just trying to share this information because I know I get this question a lot. Next slide, please. So I've mentioned the amazing progress that's been happening on the state level so far, and more states, there's going to be more campaigns in more states starting at the beginning in 2024. On the federal level, there's been some really exciting progress on the Safe Step Act. I included the bill numbers this Congress. If the bill doesn't pass, there's going to be new bill numbers starting in 2025. But so far this year, we've made amazing progress. We have 117 co-sponsors in the House. We'd love to get to half the members of the House of Representatives, which is 218. So we're well on our way, but even before half the congressional session, so that's exciting. 37 Senate sponsors, which is over a third of the Senate, also really exciting. And then the big news is that Congress has been pretty concerned about drug policy in the nation, and they're trying to pass a pharmacy benefit manager reform package to try to bring down the costs of drugs, which is great news. And the good thing for patients is that the Senate package includes the Safe Step Act so far, which opens up the door to potential passage this Congress and is a very positive step forward to try and pass federal reform. Unfortunately, the House draft of this pharmacy benefit reform package does not include the Safe Step Act yet. So I think my next slide, I'll talk further about some of the steps we're taking right now to try to bring the Safe Step Act to a reality and pass it in Congress this year. We'll see. Next slide, please. So some of our strategy for trying to bring the Safe Step Act past the finish line is we do want the Senate to pass the PBM, the pharmacy benefit reform package, and keep the Safe Step Act in that package. And with 37 co-sponsors, we're well on our way. There's a lot of support, bipartisan support for the bill in the Senate, which is great. We're also working really hard to boost co-sponsors in the House quickly. So I mentioned we have 117. If we can get to over half the House, so over 218 co-sponsors in the House, that'll really demonstrate to leadership how popular the Safe Step Act in both chambers, both the House and the Senate. And then hopefully that sets us up well to be included in the final PBM reform package. I feel like I'm trying to explain a bank shot in pool or billiards. So obviously a lot of steps have to happen in the right way for the bill to pass, but this is the roadmap that we've sketched out to try to finally get it past the finish line in the PBM reform package. Next slide. So it's been amazing to see how advocates have really rallied around the Safe Step Act this year. And I think that's why it has been such a popular component of Congress's work to reduce drug prices and improve access. So some of the things that you can do as advocates are to work with AiArthritis and get involved in their lobby days, whether that's virtual or in person. Respond to emails asking you to take action by emailing your legislators. We call those action alerts, or just reaching out individually to your members of Congress. And really the ask is simple. Just ask your legislator to co-sponsor the Safe Step Act. What that means is your legislator will, write their name saying, I endorse the Safe Step Act. I mentioned on the House side, we have 117 co-sponsors. If we get to 218, the bill will be in a really strong position in the House. So just keep asking your members to co-sponsor the Safe Step Act. And that'll go a long way towards, encouraging legislators to show their support for the bill. One thing that is helpful when you ask your legislators to co-sponsor the bill is the same way Jody and Brittany explained why step therapy reform was important to them. Sharing your story and explaining to your legislator about why it matters to you can go a really long way. Lobbyists have given the data to legislators, but they really wait to take action until they hear from you and hear from their constituents, and your personal stories, your journey of your, dealing with your condition and trying to get access to the right medication are what motivate legislators to take action and finally say, yes, I endorse this bill. So bottom line here is, would love for you to get involved in advocacy for the bill. It's a promising time. It's hard to pass a law, as we all know, but this is a promising year, and it could bleed over into next year. Reaching out to your legislators, sharing your story, and asking them to co-sponsor the Safe Step Act would go a really long way to trying to make sure that every employer commercial plan includes a step therapy exception process. I think that's it. Yeah, thank you.
All right, I was trying to find my unmute button. So thank you for all that information, Sarah. And yes, there are, I'd say, so I haven't seen any questions popping up so far, but we're going to start a discussion, and I'm going to share a couple materials just on the back end to highlight some of the things that Sarah's already said. And then we're actually going to turn off the background, and we're just going to go on camera. We're going to talk with all of you in the chat about these issues and how you can get involved. And saying that, I'm going to grab something and put it on my screen from another screen I have up here. There we go. All right. Can you all see my screen? Jody, Brittany, do you see? Okay.
Yes.
So part of this Knowledge is Empowerment program, by the way, this class, there's all kinds of things. You've seen some of the videos. You now know we have a glossary. So again, if there's any terms that you heard that Sarah was saying and you're like, ooh, I'm not sure what that means, if they're not already in our glossary, we definitely want to put them in there. So if there's anything you're not sure of, and if you can either say it in the comments or you can let us know afterwards. We don't want you to feel uncomfortable, like, oh, I don't want to say if I don't know this or not. So we'll definitely do a follow-up survey, and you can let us know that at the time, and we'll add your suggestions to our glossary. In addition, we have field trips because, those are fun. And so one of the things that involve field trips, or if any of our staff go somewhere in this case, I went to Washington, D.C. last week. I went with the American College of Rheumatology, and we talked about step therapy, and we talked about trying to get people who are not already co-sponsoring, these legislators, to support the Safe Step Act, which Sarah just talked about. So you can see how this is a group effort. So it's the National Psoriasis Foundation, it's AiArthritis, I don't know, Sarah, how many people are in the coalition, the Safe Step?
It is a huge coalition. We have 218 patient and provider organizations all working to pass this bill. It's one of the biggest coalitions on the Hill that I've seen.
And it's not specific just to patient organizations, or is it all patient organizations? And
patient and provider, so medical professional organizations. Yeah.
All right, perfect. And so the reason we wanted to have Sarah on too is, as a leader of this coalition, that was important to us to make sure that she was here, and National Psoriasis Foundation was here as an expert. So in saying that, I went with the American College of Rheumatology. And so we were given points, these handouts, which I will actually share. So if you've registered for this, I'm going to share these handouts. They thought they were really great. And this is a similar map to what you just saw. And just so you know, bipartisan means both sides, so Democrat, Republican. And that's a good thing. When there are people from both sides, it definitely makes a big difference. So we provided them, here's another example, Arthritis Foundation. These organizations were all working together to give information. So some of the points that I thought was really, for me, exciting was these are the points that we were really trying to put forth and let them know why it's important. And one of the things is me as a person with liver diseases, I was speaking to the legislators in Missouri, and I was teamed with 2 rheumatologists and 2 rheumatologist fellows, one who's a pediatric rheumatologist fellow, and then myself. And they provide some of the basic information, and I provide the story that relates to the points. So I'm going to actually share with you here my story. I'm going to come off we're going to come off this background here. But this is the one that I focused on. The patient is already stable on the prescription drug treatment selected by their provider, and that drug has been covered by their previous, my current insurance plan. So that's the point. Stop sharing. That was important to me. And I'm going to share my story. Then we're going to open up. I'm going to turn the floor over and have Jody and Brittany and Sarah. We're just all going to kind of talk about what all of this means and how we can get more involved. So for me personally, I was on, my drug is called Cosentyx, and it did take me a while to get on a treatment that was going to give me continuity of care again. I was on one for 6 years. I did really well. I had a really serious health situation that disrupted my immune system, and then my biologics stopped working. And as we all know, it takes sometimes a long time to find that right one. And I found the right one, and I was back to continuity of care. I was actually at DC taking pictures of myself in front of Capitol Hill. And then all of a sudden I get a letter in the mail from my insurance company and said, guess what? We no longer carry Cosentyx on our preferred drug list. It's also called a formulary. You'll see that in our glossary. And we want you to go to this other biologic. And we did try to appeal it, we being my rheumatologist and I, but it went through this prior authorization period where the doctor had to re-prescribe and authorize that this was going to work. Then they had to try to prove that it was medically necessary for me, which we were not winning that fight. And so this went into this loop, and I went over 2 months with no medication. I finally did have to try and fail the second medication, which caused a huge reaction in my leg, and I had a softball size welt for almost a month, and I had to buy all new pants. It was so painful. So I was able to get back on the original one, but while off, I developed neuropathy, and this was a year ago, I still do not have feeling in the bottom of my feet. I cannot feel hot or cold. I have burned myself without knowing. I have stepped on glass and walked around it with my feet for I don't know how long. And I also still am having issues with my left eye. I have pieces of areas I can't see out of, and it's not getting any better. And the only explanation is uncontrolled inflammation. So these are the reasons, and my story might be unique, but we all, I feel like, have similar stories. Brittany, Jody, did you want to kind of expand on, again, open discussion, anything you saw in Sarah's presentation, or just in reasons why you think it's important for people to know about this?
Well, probably about 5 years ago, I was going through in the step therapy, I guess, abyss, where I had failed on a medication and we were trying to get a new one approved, and it got denied. And there's an appeal process. We appealed, it got denied. We appealed again to get a peer-to-peer review with the rheumatologist. They gave us a doctor, not a rheumatologist, and this person made the decision that I could not go on this drug because they hadn't heard of it. And all you had to do was Google it and you could find it. So I was forced to use something else. This took not days, not weeks, months to go through. As a result, joint damage, had to cut my work schedule down. Here I am 5 years later. I've never gone back full-time, permanent joint damage. So these laws, it's so important. And to speak what Sarah said about going to Capitol Hill and the patient stories, I started going in 2016 with the National Psoriasis Foundation. And I think 5 states had step therapy legislation. Now we see 37, which is a testament to all these nonprofits and patient groups and patients going to Capitol Hill or to your state house or to your local. You could just go to your local legislator's office and you tell your story, and that will change the laws that we need.
Yeah, I think something that we don't we don't hear about enough, or we don't talk about enough, is the safety that comes from all of this. Like, not only could you have further disease progression and have allergic reactions or deformation if you have rheumatoid or psoriatic arthritis, there's all of that, but there's also the safety concerns of which drugs you're given the options to. Like I mentioned, methotrexate at the beginning. That's the first thing almost everybody with arthritis gets put on. And it's also one of the least safe, and then you go to sulfasalazines. Also, again, it's been on the market so they know what it looks like longer, but it's still unsafe. To give that to a teenager or a young adult or anybody really is just mind-blowing when we have safer alternatives today. And granted, when I had it, it was the early 2000s, and there weren't that many options, but there were other options, and they don't even present those to you. They just say, would you like to have a liver biopsy as a teenager every 6 months because you're on this drug? And it's like, absolutely not, and holy crap. So I think we really need to make sure that the safety aspect is covered in everyone's stories, and when we're talking to legislators.
Yeah,
That's a really,
sorry.
go ahead, Jody.
Well, just you had mentioned, we keep saying cost. You mentioned that sometimes it isn't even less expensive. And actually, I did get stuck in that one time. I was getting a very expensive treatment, and it stopped working. It was causing some health issues, and my rheumatologist wanted to change me. And it took us a while to get a lesser expensive for the same reasons you said. They wanted me to be doing this more expensive treatment. So it was kind of the reverse until my doctor finally, luckily I have a great, you have a great doctor, said, look, this is detrimental to her health. She cannot stay on it any longer. You have to change her. But it took a while, took a couple months for that to happen. So.
Yeah, I think that's a really good point. And sometimes I'll hear concerns on the Hill, because they're worried about spending money and staying, there's a whole budget debate right now. But there's some worry that if you just let patients take whatever they want, they're going to take like the Gucci of the medicines, which is not the case. I mean, first of all, as Brittany, you pointed out, there's not really that many options for patients on what's going to work for them. And Jody, what you pointed out is patients want the one that's going to work. And if there's one that's going to work, that means lower cost sharing for them, even better. So another thing that we talk about, and I think both of your stories really illustrate well, is the long-term implications. So Brittany, you mentioned putting a teenager on methotrexate. You have 4, 5, 6 more decades to live with your condition. Making sure that you can minimize those health risks and irreversible damage, so that when you get onto Medicare, you're healthier, and as you're going through your employment years, you can work full time and contribute and take care of your family. And these stories it's saddening but very motivating. These stories that you share are stories that many patients across the nation are also experiencing, and I think that's one reason why the Safe Step Act and the step therapy exceptions laws, like Jody mentioned, have really taken off in the states. And that's because they affect a lot of people, and it's really reasonable to just ask for an exceptions process. So yeah, the more people that are willing to step up and talk to their legislators, encourage them to co-sponsor, and even if your legislator doesn't co-sponsor immediately, but keep sharing these stories or keep following up and checking back in, can go a really long way. And hopefully we can get these very reasonable reforms in place for all Americans.
Yeah, something I also, we're going to jump in here to just how to share your story also in a minute. And it doesn't mean that this discussion needs to end. And we always like to have class discussions open. And if an idea spurs from looking at something, by all means, jump in. And same thing with those in the chat. But sharing your story, not as difficult as you might think. So if you think back on things that we've talked about today, chances are something has struck a chord. This has happened to me. This is how I felt. This is why I feel this is important, right? And there's many ways that you can share your story. We're showing you examples of videos, but those aren't the only ways that you can share. And saying that, I'm going to share my screen. Again, we're going to go back to the PowerPoint here. And just to understand that patient stories matter. I can't even explain how much. And I think that one of my favorite bullet points is the last one. There are great stories that are examples. We need examples. Your legislators, people who make these laws, they need to hear your examples. And then the more of us, hundreds of stories, it's impossible to ignore. Some of the things that have happened to me when I've shared my story before, and I've heard this from other patients, is they've been told, oh, well, you're an exception. You're probably an exception. Oh, this is just I'm sorry that happened to you, but not everyone walks around with glass in their feet, right? Like my story. I get that. But hundreds of stories can't be ignored. And it's that collaborative, those accumulated stories where it starts to say, oh my gosh, well, it may not be glass, but it may be, you know, something else. And we need as many as possible. So that is super, super important. I saw that Michael did share a link. It's to a form and to a Google form where you can submit your story. When you go on there, you'll actually see there's 4 different topics, because we have 4 different class topics in this knowledge is empowerment. So you do have an option of which, in this case, it would be step therapy. But if you do have more than one step therapy, or you have some of the other topics that we cover, like precision medicine or an accumulator, which is another insurance issue, you can use the same exact form and you just click which topic that you want to submit. So you can do it via writing. We do ask if you fill out the form to let us know where you're located, even outside of the United States. I understand that we're talking about some examples on how to move United States legislator forward, but step therapy isn't unique to the United States. So there are these stories are equally important no matter where you live if you're having access to treatment. So you would put it under the step therapy. We would then reach back out to you knowing that where your location is, and we can help you get these stories to the right people. So one way is, if you have experience and I know, well, I'll turn it back over to Sarah too before we get off, because I know you have an amazing website that people could click on and be able to find their legislator, and even just click and share, you know, a letter. We also at AiArthritis am getting ready to publish one of those as well. But there are other ways. If that's not comfortable to you and you'd rather somebody like AiArthritis or other organizations take your story and can package it, we do that. That's one of the things that we specialize at AiArthritis, so we can do that as well. Let me go to, I'm going to have you share another clip from an example of the type of story with Abby. And in this case, Abby was not comfortable doing her own video. I don't show me on it, but it is me first talking to her and explaining it. And then I turn the camera over to her and we're just naturally capturing a conversation.
So then I get put on a new medicine, and then, you know, it would stop working. So my doctor wants to switch me to a different medicine. And the insurance company, of course, is like, no, we're not going to do that one. You actually have to be put back on this one. And the doctor's like, we already know that one doesn't work. So why are we going to put it back on this one? So, of course, you have to abide by insurance, because I can't afford like $3,000 medicine. Like, are you crazy?
So point being, again, these can be very easy to do at AiArthritis. Our goal is to help you to create these kind of videos. They are not overly produced. They are straight raw footage from cell phones. We put some music to it and before and after. They're short, they're easily shareable. You can even share them on social media and tag legislators as well. But again, there's many ways you can submit your story. Just as long as you're registering to be part of this program, we will make sure that your stories get where they need to go. And again, that link is
So,
all right. Before I get to the action plan, I am going to share my screen again one more time to something else. Hold on, let me find where that went here. I'm going to stop sharing really quick so I can find what it is that I'm looking for here. I had another document that was up, and now I'm not going to be able to find it because I have too many things up. Well, shoot. There was this really good example of what a pharmacy benefit manager was that I had from my visit, and I was going to show all of you that. There it is. Okay, there it is. Too many things up. So let me share this back. All right. So Sarah had mentioned pharmacy benefit manager, or PBM. In the flyer that I'm going to share with you, again, this is what we were given at the American College of Rheumatology. I just wanted to briefly mention that you're going to hear a lot of things in conjunction with step therapy. This is coming up a lot, and a lot of the legislative, they are trying to roll these into sort of a bigger package. So essentially, so you all have contacts in the American system in the United States, we have the insurance, and they're kind of like middle people. So these PBMs, or pharmacy benefit managers, have been around, again, just like step therapy, a long time, and they were brought on in order to try to contain the high cost of drug prices. However, over time, they basically have abused the system, because what happens is they negotiate these prices behind closed doors, and nobody knows where the profits are going. We know they're not trickling down to patients. We know that our healthcare costs are not going down. Our copays are not going down. So there's a lot of legislation in order to make them show their work. Think of math. We're in school, like show how they're coming up with a problem or solving their problem. And in doing that, they are tied in to step therapy, because these are the people who are negotiating the prices for that list of preferred drugs, of the formulary, the drug list, the one that is saying, hey, we've negotiated a price here. Now the insurance company is going to switch you. So these people are directly tied to the step therapy. So I did want to mention that as well. Before we start to go into our last 5 minutes, I wanted to turn it back over. Sarah, did you want to comment anything else about pharmacy benefit managers, or sharing stories, or anything, your website, anything that you want to add?
Yeah, thank you. We do have a website that we maintain. It's www.steptherapy.com. If you'd like to learn more, you can learn more about both the state efforts and the federal effort. And if you're in a state that has passed a law, there's even a link for a form that, speaking of all the collaborations, the Coalition for State Rheumatologists come up with, that's super helpful if you want to try to seek a step therapy exception in that state. I saw Michael's form that they created on patient for telling your story. It looks like a great form. I think what I would leave you with is, we'd love for you to be involved in this kind of thing. Patients are going up against pharmacy benefit managers and health plans that don't want to pay out for care, even though that's their job. And it really takes all of us speaking up. So taking advantage of these forms, working closely with AiArthritis, you can't go wrong. And just really appreciate everyone being willing to share, and Jody and Brittany and Tiffany as well, being willing to share your story and show people what it's like and how to go about it. So thank you.
Yeah, absolutely. I'm going to reshare so we can start to get to the end here of this. So we are into the action plan. So again, listening to other patients. Here's something else we'd like to be able to achieve with this knowledge is empowerment. So we talk to each other, right? We're on social media, we're in groups. That's how we met a lot of these people that are on this webinar today. So we'd really like a goal, because story sharing is so important, is we hope that through this webinar and through listening to some of these other videos that we have in our large video library, that you will hopefully be able to recognize. So we encourage you, listen to other patients, like on social media. Are they complaining about something that sounds familiar to this? That's another story. And we could possibly help them to identify, maybe there is a step therapy bill. Like Brittany, you shared in the beginning, can you reiterate that, you knew that there was something passed in your state, so you were able to challenge this.
Yeah. So luckily, I just was told when I was getting ready to switch drugs, like, hey, insurance usually wants you to do this one. It's the same mechanism as something else you've already failed. It's just a pill instead of a shot, but they're probably going to make you do it. And then they didn't. And I was like, whoa. So much so that I was like, are you sure? And the nurse was like, yeah. And then Michael and Michelle told me, you know what? There was a step therapy law. They can't do that to you anymore. And I was like, oh my God. They don't even know. Like, there's so much happening behind the scenes, and the patient's just sitting there waiting, go, I don't know. I don't know.
Exactly. So we really think, again, this program being developed by patients, and we recognizing we're always hearing these similar stories. So maybe if more of us understand how to identify these stories, send them our way. We're working with National Psoriasis Foundation and all these others. They're leading the coalition that we're part of. So we will get your stories through all of these processes, regardless if they come under us, if they come under National Psoriasis Foundation, whomever you feel comfortable. But I'm telling you, if you see people talking about this and you're not even sure, say, I think this is what it is, check out this program and let them know, is it something that we can help them with, and how can we help them with access, even if it is sharing the story. Here's a little pop quiz, because good classes without a pop quiz. These are things we'd like you to just ask yourself, can you answer these? And feel free to, if you feel comfortable, letting us know in the chat. If I could answer all three, or maybe not one of these. So I feel I could briefly say what step therapy is. I feel I can provide at least one example why step therapy may not be good for me. I feel if I heard someone else sharing a story about needing to fail first a different medication before being able to have the one that prescribed to them, I could say, hey, I think that's step therapy, then send them us. And that would be an example of on social media. I don't have my chat up anymore, and I'm scared to click on it because some video will pop up and go off. So I'll rely on looking at the data here in a bit. Some recommended reading. We'll have a link, and all of these links we'll provide to you with a follow-up for this as well. Not very common knowledge, but in 2015, I did author a paper called The Ethics of Step Therapy. It was probably at that time the hardest thing I've ever done in life, but we have a direct link to the paper if you're interested in downloading it. I'm going to be honest, it's not an easy read. Because the audience at the time was for insurance legislators, but it's a very interesting finding. I worked with two bioethicists, and we do still utilize this argument, which essentially says, if you're not the person, if you're not the same as the people in the clinical trial, then, and that's the data that the insurance company is using to say that it's a safe and effective treatment, then you should be able to override step therapy, because your doctor has that ethical obligation to treat to the individual characteristic of the patient. And that little graphic was actually my wall. That's how I was working on solving that problem, as I had all of the things, and it was like an FBI map. And then I also, our library collaborators, which Sarah has mentioned, part of this project is recommended reading. So we are not interested in duplicating efforts. We are not interested in using our precious donations and funding to recreate something that's already out there. So we have library collaborators such as National Psoriasis Foundation, Arthritis Foundation, Creaky Joints, so many. And we're so happy about that, because we are all trying to achieve the same thing. So they have great resources. We're going to share them with you. So you will be connected to all of those great resources as well for being part of this project. And the field trips, as I mentioned. So if you are signed up to this program, you're going to get the first field trip sent to you here soon. I just got back from Washington, D.C., as I mentioned. In addition to the American College of Rheumatology, I went to 2 other conferences, meeting with the Centers for Medicare and Medicaid Services, which is the photo on the top. I send little video updates, which you see on the left, and I just love this little picture. That's Anna Hyde with the Arthritis Foundation. Just another example of we really do collaborate and we really do have relationships, these organizations with each other. And you'll also be connected to Elevated Experiences, which is personal mentoring and other behind the scenes opportunities to learn how to do things like testify, write public comments, all kinds of things. So we definitely have that option to be Elevated Experience if you so choose. And there we go. That is a wrap. I want to thank everyone, especially the patient committee of the AiArthritis volunteers who are part of making this program happen. Two of them sitting on here right now, Jody and Brittany. We could not do what we do without our volunteers. Our volunteers have been responsible for helping us make the videos, the glossary, creating the webinars, every part. So if that's something you're interested in, that's always an opportunity as well. If you'd like to get more involved, also a shout out to all of these other volunteers that are not on camera today, some in the chat, and for staff who's part of it. And then if you are signed up for the program and you want to be more helping behind the scenes, Michael, who was in the chat here, is always happy to personally walk you through all of your opportunities. And I will stop sharing. And that is a wrap. I want to thank Sarah and Brittany and Jody. Thank you all for being on here. I so appreciate your participation in class today.
Thank you.
Yeah, thanks for having me.
Thank you.